lot of times it's psychology, man. It's just like, these people are addicted to this garbage, and you got to like walk them down and show them better options. I get to see happy people that are getting healthy, and the patients are happy because they're actually seeing progress for the first time. What happens on carnivores, you often eat twice a day. That's pretty typical. So you're not eating every 15 minutes like you might on a carb-based diet. I've talked to people that have had ileostomies, they've had their colon removed and they just poop into a bag. And you ask them, hey, what happens when you eat meat? Nothing but a little liquid comes out. What happens when you eat vegetables? Guess what would appear in my bag at the end of my small intestine? A little triangle of carrot, completely undigested.
I want to talk more about your new clinic.
I tell the people, look, I don't want to see you in 6 months to a year. I hope the hell you're gone.
Awesome. Dr. Baker, it is such an honor, man, to have you here and have an opportunity to chat with you. Welcome. Thank you for taking the time.
Well, yeah, I appreciate it. Thanks for having me on, and I look forward to hopefully sharing something of value to you, whoever your audience might be. So thanks for having me.
Yeah, the audience is primarily weight loss. Lasting weight loss is sort of the focus on this podcast. I have a clinic that focuses on achieving lasting weight loss. We have a very unique twist. I had a podcast last night with Dr. Sivis, and we were chatting about you. He told me to bring some stuff up, actually, so I'll bring that up later. But we're involving a lot of carnivore lately into our protocols. I love what you're doing with the national clinic, Revero. I definitely want to talk about Revero. I'm interested to talk about that too as well. But yeah, just this overall approach of using integrated lifestyle interventions. It's my biggest passion. So, and I know you share the very same type of passion too as well.
Yeah, absolutely. I think weight loss is, I was just interesting. I just put a video out on social media talking about how obesity impacts the brain. And, because we always think about how it affects our body size and some of those things, and some of the conditions we know are associated, like diabetes and hypertension, but it has tremendous impacts on the brain and brain prognosis and predisposition for things like dementia. And then certainly it impairs cognition. It's associated with all sorts of mood dysregulation. So it's an important thing to take care of for sure.
Yeah, without a doubt, man. I would love to, because for me, I'm going to kind of switch it up on you and ask you a more personal question, if you don't mind. For me, what gets me motivated and passionate is because I lost 100 pounds myself. So that's why I do what I do, helping other people with lasting weight loss. So being able to integrate the different approaches and see the changes with the patients, that's my biggest passion. For you, what currently drives you? What is your biggest motivator that keeps you going every single day?
As you have mentioned, I promote this kind of so-called crazy carnivore diet, and I had no intention of ending up here. This was not ever on my radar. When I went to medical school and became a surgeon, orthopedic surgeon, I thought I'd be replacing knees and hips and shoulders and doing fracture care until I was 75 or whenever I retired. And so this obviously was a diversion for me, I'm glad I went here because, one of the things I see literally on a daily basis is people with all types of chronic disease, from neurodegenerative diseases, from mental health disorder diseases, to autoimmune diseases, to inflammatory metabolic diseases. You name it. I mean, just about everything. We see people that, they're legitimately trying to get healthy. They're within the sort of the allopathic healthcare system where, it's just disease management. And so they just go from one doc to the next doc, this pill to that pill, or this procedure to that test. And they never really get healthier. They just kind of manage symptoms. Maybe they feel a little bit better from time to time. And then we get a hold of them. And it's like sometimes within weeks, 20 years of disease goes away, and they're shocked. They're happy, of course, because they're no longer suffering. But at the same time, it's like, I just wasted 20 years of my life on this stuff. And all I had to do is make some simple lifestyle changes. And the unfortunate thing is, as physicians, we are entrusted in people's health, and, we're supposed to be experts in this, and we're experts in a very narrow range.
Right.
And we know what pills, procedures, potions to prescribe, and that's it. And I made this comment the other day about what a doctor is supposed to be a teacher. And what are we teaching people? We're teaching them to be dependent upon a broken system that just feeds them drugs all the time. And really, when you look at it, what goes into creating health? It's obviously nutrition, it's obviously sleep, it's obviously activity level, it's how we interact with light, it's how we manage stress. And we're not experts in that. We're just, and we should be. Physicians should be experts in all those things, not just appreciate that they're relevant. We should have a deep understanding and expertise, and also be able to display it. Like I said, you lost 100 pounds. We're both in, relatively good shape. I think most people would say, hey, this guy at least knows a little bit what he's talking about. And in many cases, we see physicians that are miserably out of shape. And I get it. It's just a stressful life. You work a lot of hours. Maybe you can't take care of yourself. But the reality is it doesn't really take that much time. You know, when you think about it, it's not like I'm spending 6 hours a day in a gym. I'm spending 30, 45 minutes at most days. Some days I don't, a lot of days I don't train, and my nutrition it's super simple. So it's even less time. So anyway, I'm passionate about, hopefully fixing this problem we have with the healthcare system and saying that, because our profession, I saw a recent survey that the trust that people have in their doctors now is down at an all-time historic low at around 41%. Now, COVID didn't help that.
No, that smashed it.
Right. There was always some people that had kind of always been a little bit questioning, but in years past, doctors had been looked up to as, someone with some level of trust and authority and respect. And I think that's been undermined a lot. And it's their own fault. Quite honestly. It's like, look, if you're going to continue in this vein where everybody's sick, everybody's overweight, everybody's depressed, and all you can do is here's another pill, I think we deserve it. I think it is deservedly so, that lack of trust. Hopefully we can restore it and rebuild it. But I think the physicians themselves have to. They're not entirely to blame. There's a lot of business and corporate interests and all this stuff that push there, and you're in a position where you're in massive debt by the time you get out of your training, and you got to do what you got to do just to survive. But at the same time, smart, capable people, you should be able to figure this out and turn it around.
Well, it's funny you say that, because with the current people that are appointed now in the higher levels of, RFK Jr. and, the new chair of the FDA, if we're ever going to be at a brink of massive change, this is it, right?
Yeah, I do think we have an opportunity. I think there's a lot of people, but again, with this Make America Healthy Again, and it's nice to see. It's nice to see that they're prioritizing this, which would have been obvious for decades now. Finally someone has said, hey, look, enough's enough. And, but at the end of the day, it's still going to depend on the Americans. They're going to want to get healthy and actually be willing to do the things and make the sacrifices, or make I don't even know if they're sacrifices. Just make the changes that are necessary. Because I think at the end of the day, the population drives the markets. What are we willing to put up with? What are we willing to spend our hard-earned capital on? And if we're going to continue just to eat garbage and do that, then we're never going to get healthy. So I think it has to change from a grassroots level. It's good that the government may get out of the way a little bit and make it a little easier, but it's not going to solve the problem on its own.
No. I think, can you imagine if we had not even the same amount, but just some sort of mass media push on the basic lifestyle strategies, that like you were just talking about, the carnivore, the sunlight, the skipping meals here and fasting. Imagine if they were pushing that.
Well, let's just wind the clock back a couple of years. If I went into a grocery store, everywhere there was a sign and little placards that said stand 6 feet apart. It was on every news station. It was in a newspaper. It was on the radio. It was on the TV, all over social media. No one escaped that messaging. It was all COVID. Here's how you prevent it. This is what we want you to do. They spent the resources. They had the resources to spend. Whether it was well spent or not is debatable. But we all knew it. The message was out there. And the time I was like, where's the message to not eat junk food and get good sleep and get some sunshine? That could have been done too. You could have just said it right. You could have stand 6 feet apart. Oh, and by the way, don't eat Doritos or something like that. That could have been done and should have been done. But why didn't we do that? Well, I think the reason was because, who's making money on this stuff? And I think that's a real shame. Now, hopefully, we can sort of say, hey, look, a lot of people are corrupt. That's not a surprise. How deep the level of corruption might be surprising to some. But I think, like I said, hopefully we have a better class of leaders that can at least say, hey, look, this is something that is worth doing. And my gosh, I was just, not to pick on obesity, but obesity is a risk factor for disease. It makes your outcomes worse. It also makes you more likely to spread disease. Most people don't want to talk about that. Obese people harbor greater viral loads. They spread it more 100%. Easily. And yet that was never even mentioned. And why wasn't it mentioned? And I saw people saying, oh, no, now's not the time. There was literally people in the UK. I remember some dietitians group in the UK say, this is a stressful time. It's not a good time to go on a diet. Just eat your comfort food, maybe have some sweet treats to kind of calm your nerves. That was being said by literally licensed, credentialed people. that had a large audience. And I was like, this is absolutely insane.
The entire tone was very apathetic and, people, very low levels of responsibility. So anyways, yeah, no, I mean, we're definitely on the same page. Obviously, one of the big things I'm going to talk to you about in the context of weight loss is carnivore. But before we go there, because I'm sure that's the first thing they start chatting with you about, because you are the guru when it comes to carnivore. I want to talk more about your new clinic, because I have a ton of interest in learning more. There's a lot of patients that we're going to be referring. I just heard about this literally a couple of days ago. I didn't know you were involved in that. I thought that's super cool. The price looks freaking great. Yeah, tell us more about what you're involved in and what you're doing there.
Yeah. So, about 15 years ago when I was practicing orthopedics and I started to say, hey, there's some lifestyle things I can do that can make a difference. The problem was seeing 50 patients a day. I got zero resource. I mean, the best I could do was, hey, go watch this video. Hey, go read this book. That is really, really an ineffective way to make change. And I think when you're dealing with people who are dealing with chronic disease, whether it's diabetes or Crohn's disease or rheumatoid arthritis or whatever it might be, it's more than just, new patient visit, take some tests, here's your pill, see you in 3 months, see you in 6 months, ad infinitum. I mean, that doesn't do it. And so what I found and what we found is lifestyle definitely, I mean, you can put disease in remission and we see it every day, right? But the problem is you have to have a physician that gets it. And so we've hired all kinds of physicians in every state that understand this and are motivated and on board with this stuff. So their goal is to, if it's possible, deprescribe medications and actually get into the root cause of why you might be sick. And then beyond that, one of the other big things is you have to have some level of support there, because a lot of people, you can kind of get them motivated initially from a visit and then that fades away. And so what we do is we assign a healthcare team, an entire team to these people that will literally interact with them on a daily basis if necessary. I mean, we track data from them. They upload data. We send information to them almost every day. As things improve, we're able to discontinue medications rather than just check in with me 3 months from now and see if we make change. I mean, we can do it like, if 12 days goes by and you don't need your blood pressure meds anymore, we'll discontinue that. So, a lot of education, a lot of support. There's, obviously technical support through apps and stuff like that. So we can gamify and motivate people. Nice. To do that. We're collecting data so we can publish this and show that not only are we reversing diseases, but we also are saving money, because, the healthcare system is $5 trillion a year, essentially, of what are we getting for it. So we're in 48 states right now. We'll be in the last 2 by the end of the month. We kind of launched last year and we just kind of slowly ramped up, and now we've hired dozens and dozens of providers all throughout the country. I mean, I think it's like how healthcare, in my view, should be practiced. Yeah. But I mean, you think about it, you're not incentivized for this stuff. Right? There's no incentive to spend an hour talking to your patient about life. So I mean, you can bill like for time sometimes, but it's really the priority. I mean, for me as a surgeon, they paid me to cut people open. There's no doubt about it. I mean, that was it. That was it. That was my whole salary depended on how many people I operated on. So I mean, that's the reality of that. And, just totally changing gear and saying, how do we actually fix people? Because we have this chronic disease epidemic and it's very expensive. And we have some of the worst outcomes in the world, given how much money we spend for it. And this is a way to say it. And I talked to a woman the other day. I mean, she spent, and this is not an exaggeration, she spent over $1 million on infusions. So she had this crazy chronic inflammatory demyelinating polyneuropathy. And she was on these immunoglobulin infusions, which are 100,000 a piece. You have to do 2 of those a year for 5 years. And then she was taking rituximab and other biologics, which was very expensive. So she spent well over $1 million. And the results were at best minimal, a little bit of improvement. Chronic pain, could barely walk, was told she's going to be in a wheelchair. She went on carnivore. And I mean, within 2-3 months, she's like, I'm gone. I'm better. I'm no longer, suffering. I don't have pain anymore. So yeah, I mean, it's just a better way to do practice. And again, more and more physicians, because the other thing as a physician, from the physician standpoint, a lot of docs they're just grinding and burned out from not seeing people get better. It's just like, it's another person, another problem, another issue. Depressing. You never see progress. It's just, and then you blame the patient. Oh, the patient's not compliant, or whatever, or you just feel hopeless. And right now, all of our providers are like happy. They're like happy to come to work. They're like, I get to see happy people that are getting healthy. And it's really changing the dynamic, and the patients are happy because they're actually seeing progress for the first time. So it's empowering, because, the medical care system, when it comes to chronic disease, you get some diagnosis and you're said, hey, why do I have lupus? Well, we don't know. Maybe genetics. You don't really know the cause. It kind of give you some unsatisfying answer. What do I do about it? Well, you're going to take these pills for the rest of your life. It's going to progress.
Steroids.
Right. You're going to take steroids and biologics and all that crap. And then that's really disempowering because, not only do you not know why you have this condition, but now you're dependent upon some other Joe Schmo to give you drugs to live your life. And then that's depressing. And then you can say, wait a minute, I think we know why this is going on. And there's something you personally can do about it. Let us help you get there. Such a much better way to practice.
Oh my gosh. That's what got me so excited when I learned about what you were doing. I ran and showed my fiance. I'm like, look what Dr. Baker's doing. This is super cool. So questions I have, does it replace your primary care, or you guys are making it clear you're not replacing the patient's primary care?
Yeah, I mean, we can't because it's digital, right? Okay. So we can't take care of people with broken bones or sprained ankles or, there's limitations with it. So we can't fully replace a primary care physician. We're kind of an add-on to that. But I mean, the goal is, and honestly, because I meet with these patients every week. I have a meeting and I meet with all the patients, just as a little personal type of thing I like to do. And I tell the people, look, I don't want to see you in 6 months to a year. I hope the hell you're gone because we want you fixed and out of here. So you don't need to be dependent upon all this medical service all the time. So, I mean, medicine should be, hey, broken bones, acute illnesses, pregnancies, some of those things that I think we do really well at in this country. And then the chronic disease side, we do just abysmally wrong. I mean, you think about all the drugs and technology we've poured into chronic disease, and chronic disease is just as prevalent as ever. I mean, for every diabetic drug that gets out there, more diabetics occur, right? This is like they're making more patients. So because the motivation and incentives are so backwards.
Yeah. And I'm sure that wasn't by design or anything because it doesn't feed a perfect business model, right? That was just accidental.
Yeah, I mean, I don't know if you saw back about 3 or 4 years ago, Goldman Sachs was asked to to study the feasibility of curing disease as a business model. They unequivocally said curing disease does not make sense from a business model. It's just not a good business plan. So what we are doing is not a good business plan. Honestly, it would be better if we had this ongoing, you need care for the rest of your life type of thing. But I'm not interested in that. Honestly, I'm not interested in just making a buck just on sick people. I'd rather see people get healthy.
100%.
And I think society's better. And I think that's a worthy goal.
Yeah. So we got the clarity on that aspect, a good adjunct, hopefully an unofficial replacement, right, of your primary care. Is it just coaching nutritional, or do you guys incorporate other kind of anti-aging, anti-inflammatory treatments like microdosing GLP-1s, low dose naltrexone, peptide therapies like BPC 157? Do you guys get into any of those therapies too as well?
We don't do any of that stuff as of yet, just because I think, honestly, I don't know. I mean, I know there's a lot of interest in that stuff, and I don't know that we've fleshed out everything about that yet. Certainly that we focus on lifestyle. Nutrition is the main focus for sure. Sleep, exercise, activity, circadian stuff, all those things. We do prescribe medications when indicated, sure. and that's something because we have licensed providers that can do that. But I mean, our focus is really more subtraction than addition type stuff. And I think all those different adjuncts, I mean, honestly, for all the BP 157s and the natokinases and all the other stuff, I mean, if you don't get the food right, you don't get the sleep right, you get the not sedentary, I mean, that's all fluff anyway, in my view. I mean, yes, it can make some differences in unique individual cases, but, it's just like weightlifting. You do the basics, and then you can do the add-on, whatever superset exercises later.
If you don't have the basics of your primary lifts, the supersets and the fluffs, I totally track with what you're saying. Yeah, it's interesting because I agree with that. We do that. I do have medical providers that do all that, cutting edge anti-aging therapies, but we don't do it unless they do lifestyle first. And so that's kind of our prerequisite. Like, you have to be making the best attempt as a patient. There's plenty of other people that'll sell you this crap, but I'm telling you, you're going to waste your money. Like, you got to do this stuff. You got to get this basics.
Well, here's an analogy I used to use, because people would ask me, hey, what about stem cells? What about PRP injection? What about, all of these things have come and gone throughout the years, and some of them have been a waste of money and so on and so forth. But I'm like, let's just use the analogy of let's say I got a house and I want to put some new carpets in or new floor. I want to put hardwood floors in the house, right? Make it look a little nicer. This is the equivalent of one of these treatments. But I say, but if your house is on fire right now, it's not a good time. right? Let's fix the put the fire out first, the metabolic disease, fix all that stuff. And then perhaps those things are going to have more efficacy. And I think because you see a lot of mixed results when you look at studies on people taking stem cells or whatever. And, American Academy of Orthopedic Surgeons says stem cells don't really work. It's equivocal. I mean, and part of that is, there is a conflict of interest because if I can inject my shoulder with rotator tendinopathy and it gets better, but my job is to put a scope in there and do that, then I'm kind of disincentivized to say that these other things work. So I know there's a conflict of interest there, but it could be that, what is your patient population looking like? It's like people that go on testosterone replacement. I don't take it personally, but there's people that go on it. They still have a crappy lifestyle, still eat garbage, and it all gets, aromatized estrogen, and they're not getting any benefit. So you got to build a foundation first. And I think that's honestly, for the patients we deal with that have these diseases, it's probably because they haven't focused on those things. And we have to really, a lot of times it's psychology, man. It's just like, these people are addicted to this garbage, and you got to walk them down and show them better options. And you literally have to hold their hands for months and months at a time sometimes until they can finally say, hey, look, I can start to see that. And the nice thing is, it often success breeds, more success because they're like, hey, wow, my knee doesn't hurt anymore. Guess what? Now I can go for a walk. I can walk more and I'm losing more weight. And they see this virtuous cycle start to begin.
Yeah. Yeah. No, I think that's 100% true. So then do you think as your company progresses, you guys might be looking into some of those therapies to add as adjuncts, or you don't know yet?
We're still scaling, right? And so, our, if we look at our business plan for the next 5 years, it's, obviously bring out the direct to consumer model, fill that out, get a decent number of patients, publish some studies, and then go into the enterprise market so we can work with corporations to say, hey, look, we can take some of your sick patients and make them not as expensive for you anymore, because there's a huge financial incentive for those guys to do 100%. That. Perhaps maybe get some, get on some insurance plans perhaps down the road. And then my personal interest in this, is let's take people that are sick, make them no longer sick, and then turn them into savages. Turn them into robust, vigorous, athletic, just really high functioning individuals. That would be my preference. Now, again, there's obviously different things you have to do to get there. It's one of those things where I look at the United States, where we're at, and it's like we are the wealthiest country. We are one of the best resource nations in the world. There's no way in hell we should just have a big, fat, sick, depressed populace, which is what we currently have. That's a real problem. And so I would because I think, people that are physically capable are more fun.
Without a doubt.
Anyways, it's like life is better when everybody around you is able to do stuff and you can kind of cooperate and be productive as a society. So yeah, like I said, that's something I would like to see us bring in, let's say people graduate from the beginning part of it, where they're no longer sick and they're not needing the meds and they're feeling better. And then we're going to say, okay, where do you go from there? And do you, like I said, maybe some of these other alternative therapies might be helpful. I think, again, I have my own personal interest as a guy who's almost 60. I want to perform at a high level, and there's things I do that I wouldn't expect my patients to do right now, but maybe later they could handle it,
Max was telling me, by the way, Bella's husband or boyfriend, I guess, Steak and Butter gal.
No, they're married. They're married now. Yes, they're married now. Yeah.
And he was telling me about his workout with you. He's like, my gosh, my back was. I was like, well, your workouts, right? They're intense, right? And I think I'm sure he's had to get acclimated to that, right? But it's super cool. I love the fact that you are pushing and raising the bar, I think, right, is important.
Yeah, I think when we talk about if we talk about capacities, right? So when we're young, so let's say 25, we're at the peak of our physical capacity, perhaps. It's an arbitrary age, but it's probably close for a lot of people.
I'd say so.
And your range of things you can do is super broad, way out here. And then as you get older and older, it's like when I'm 20, I can hop off the bench and go run sprints, no problem. Nothing hurts, nothing slowing me down. I'm pretty fast. When I'm 50, I mean, I don't know if I can sprint. I mean, I might be able to jog a little bit, but I mean, if you can raise that capacity where you can sprint again, well, if you can sprint, then guess what? Running's not hard. If you can run, guess what? Jogging's not hard. If you can jog, guess what? Walking fast is not hard. And so you just want to keep that capacity really high. And so I think, like from a, whether it's mental capacity, the ability to solve complex problems, or, physical capacity, like can I run really fast? Like one of my goals is sub 13, 100 meters at 60 at 240 pounds, which will be pretty friggin' fast. I got to run. I think I got to hit about 18.5, 18 and a half, 19 miles an hour to be able to do that, which is pretty deep. I'm about 17 and a half right now. So I got a little work to do.
I saw your last sprinting Instagram, by the way. Look good. Yeah.
Yeah, I mean, I'm hitting some decent positions. I'm starting to get there. It's obviously I got to get outside in the track, but it's still crappy and wet here, and so I want to wait till the weather warms up a little bit. But yeah, I mean, so those types of things are important because as that range gets lower and lower, and eventually we're getting to where all I can do is likely go from bed to toilet to refrigerator, and then pretty soon we're in the bed and then we're dead. And so we want to. Well, the wider we keep that range of things we can do, I just think the better it is. And I'm not the longevity guy. I'm the first guy to say, I don't know. Who knows? I don't know what's going to make people live longer. I will say, I think I know it makes people not be sick. And I think that may correlate with living longer. I mean, you can always get hit by a bus, of course, but I mean, I think that, I think being healthy is something we can reliably do. I mean, the people that are making projections and claims about, I'm going to live to 180. I just, okay, whatever. I don't necessarily, I just want to see proof before I buy that too hard. And so as of this point, I have not. I mean, the 100-year-old people that I've met in my life as an orthopedic surgeon were almost always demented old ladies in a diaper, filled with urine with a broken hip. And I was like, no thanks. I don't need that. I mean, if I'm going to be 100, I want to be functional.
What's the point?
I don't know how long I'm going to live.
Right, yeah. Right. What's the point of bragging about your age if the quality is so garbage? Like we live longer, and that's a statistic that we're really bragging about.
Yeah, I mean, obviously the concept of Healthspan, a lot of people talk about that. And I think most people understand. And if you say, hey, could I live 5 years longer, but if I'm bedridden and demented? No, I don't want that. I mean, who wants that? Yeah. So we want longer quality years. And again, quality years, I think, the best predictor for tomorrow is what's going on today.
Right.
If you're out of shape today, you're probably going to be out of shape tomorrow. If you get in shape today, you're more likely going to be in shape tomorrow. So, I mean, it's kind of some simple basic things. Yeah.
Let me lateral now into, I do want to get into a general carnivore. We'll start with autoimmunity since that kind of I saw that is your clinics really focusing on autoimmunity or more broad metabolic health issues?
Well, we definitely do autoimmunity. And I think carnivore particularly, and let me just back this up. Our clinic, Revero, is not strictly carnivore. Okay. I mean, we do it when it's necessary, and we certainly support it, but that's not like everybody goes carnivore.
That's a good question that I wasn't going to, So
it's often low carb. It's often eliminating things. So we collected data on all these people with different diseases, and we kind of said, well, what is the diet that's working for you? What foods are there? And we started to kind of compile some lists and said, people with psoriasis tend to do good with this range of nutrition, whereas somebody with diabetics might have a different range of things. Obviously diabetics are going to probably do better with a lower carb approach. But, our focus is metabolic diseases, which include obesity, diabetes, metabolic syndrome, hypertension, all the things that make up metabolic syndrome. We take care of many, if not most, autoimmune diseases. We do inflammatory disease, and that's where our focus is now. I think what will happen is we'll probably broaden our reach because I'd like to go and do some mental health stuff because consistently I see people with depression, anxiety, bipolar disorder get better when you fix their diet. I mean, that is becoming so clear. And we're seeing a lot of research, particularly in the ketogenic spaces who've had the resources to do some of these studies that show that. And we're seeing like so-called animal-based ketogenic diets is a sort of euphemism for carnivore. They're publishing that in the literature and seeing just tremendous results. And so yeah, I mean, but I mean, autoimmunity is definitely a big part of what we do.
Yeah. And those psych drugs getting people off psych drugs is fucking awesome. I mean, we have some patients that we get it's amazing. I've always said that the inflammation, the testosterone, and give them some DHA, some essential fatty acids, and they do wonders mentally. So given the autoimmune thing, I heard Dr. Kilt say, because I was with him at his little thing in Tampa, and, he asked the question too. So I'm going to ask you the same question. Do you think autoimmune disease is really just a reaction to the consumption of plants?
Well, I mean, I think
I want to interrupt the show for a quick minute to let you guys know about the free weight loss guide that I've created. I've taken everything about the flow protocol and my over 15 years experience working with patients just like you and given you guys a step-by-step guide on how to implement these GLP-1 medications to achieve successful and long-term weight maintenance. So if you see any interest in that, I'll put a link in the description so that you guys can access that free guide. Now, back to the show.
certain compounds in plants can exacerbate it. And I think that, medications can do it. I think supplements can do it. I think other environmental agents can probably lead to this. I mean, again, we don't know for sure what causes autoimmune disease, but there's some pretty strong evidence. I'll point you to the work of a guy named Alessio Fasano out of Boston Children's. He's an endocrinologist. I think he's an endocrinologist or a pediatrician or something, but he's been studying the link between gut pathology and autoimmunity. And he's published papers over the last 15 years or so. And what he sees is a very clear link between gut hyperpermeability, aka leaky gut, gut dysfunction for whatever reasons you want to describe. Could have to do with microbiome factors as well, but that seems to predispose us for autoimmunity. And what we see is, the gut is our largest interface with the outside world. Most people don't realize that the gut is a tube, and the inside of that tube is external to our body. So our mouth, our esophagus, stomach, intestines are all external to our body on the inside. It's like a donut, Right. If our body is a donut, the hole is still outside the donut, but it's still inside the body, so to speak. And so like you just if you extended that donut and stretched it out 6 feet long, that would be like, the inside of that would be external to the body. And so the surface area of the gut is about the size of a tennis court because of the villi, microvilli and all that. And 70% of our immune system resides in there. And the gut's job is to take things in. Our skin's job is to keep things out, right? Our skin is waterproof. It kind of keeps most things out. Some things can penetrate, but most things stay out of that. But our gut is, if our gut could not bring things in, we would all starve to death, right? It has to bring in nutrition. And the problem is when that barrier gets compromised in some way, now we start letting things in that aren't supposed to get in. And this is just AKA leaky gut or increased permeability. There was a group in Europe that did a lot of research on this, and they would assess gut permeability through something called PEG 400, polyethylene glycol 400. And they found that by putting people on a meat-based diet, their gut permeability normalized. And then what they would see is inflammatory markers would subside, autoimmune, antibodies would go down, and then the symptoms would resolve. So, I think there's a pretty good relationship, and that's maybe the primary etiology for this, if not certainly one of them. So yeah, certainly diet and like certain plant compounds tend to be irritative to the gut. We just see that. That's and in there. And when I'd ask them what was driving the permeability issues, and they said antibiotics can, certain supplements can, depending on how what kind of delivery agents they have. Obviously, certain foods can, sugars can, artificial sweeteners, certain plants, nightshade vegetables is one, and the oils, the seed oil type stuff, all those things seem to contribute to this.
So, and I'm sure he was being a little facetious when asking that question, and I did, not implying you thought that it was only plants, but we've never seen a therapy or a nutritional therapy have such a powerful impact on insane autoimmune diseases. So it does kind of make you want to ask that question, because it's like, how is just eating meat causing this massive of improvement? It's crazy.
Yeah. Certainly, you could say that there are a number of things that cause it, and plants are one of them, and, certain probably worse than others, but meat, when we think about it, if we look into the way our gut works, anatomy, physiology, we were designed to eat meat. That's clear. We have this extremely acidic stomach environment. And that's not cheap. That requires a lot of energy to maintain that huge hydrogen gradient, right? And that wasn't by accident. The thought is that early human species were, the early human ancestors, the Homo habilis and whatnot, were scavenging. And so they came across meat that was contaminated with bacteria, and they needed a robust gut pH to counteract that. And if they didn't, they would die. And the ones that had the greater gut acidity survived onto the next generation. And this is how that supposedly came about. But we talk about our gut microbiome is really important for us to be able to digest and absorb nutrition correctly. And there's truth to that. And so we have probiotics and prebiotics and all these things to modify our gut microbiome. But the reality is, with meat, you don't even need a gut microbiome. I mean, it's completely superfluous. And so there are people out there that have their colons removed, right? I mean, they've had Crohn's disease, they've had ulcerative colitis, they've had cancer, whatever, trauma, whatever. They lose their colon. And guess what? They can live a normal, full life without essentially a gut microbiome or any significant gut microbiome. Why is that? Is because meat is fully and completely digested within the small intestine, right? You don't even need the colon for meat. And I mean, I've talked to people that have had ileostomies, they've had their colon removed and they just poop into a bag. And you ask them, hey, what happens when you eat meat? Nothing but a little liquid comes out. What happens when you eat vegetables? And they will tell me, I've had a guy tell me, he said, I used to do this. I would take, like, for instance, a carrot, and I would cut it into a shape, like a little triangle. And guess what would appear in my bag at the end of my small intestine? A little triangle of carrot, completely undigested, And you think about it. When's the last time you looked in the toilet and saw a hunk of meat down there?
You don't.
Never.
No.
I mean, never. You see corn and other crap, stuff like that. Yeah, for sure.
So yeah, wow, that's fascinating, and I think that makes a lot of sense. And for me, it's 2 months now, by the way, that I'm carnivore. My fiance too, and she's noticed improvements. She's got some unknown kind of skin autoimmune stuff that's gotten better. But for me, it was because I've been on TRT for like 7 years, and I started at a young age. My testosterone levels were lower. My clinics was doing it. That's kind of what prompted it too. I was like, oh, my clinics are offering it. Let's do it. I think it's awesome. I had some energy issues, and TRT helped big time and allowed me to operate at a higher level, and kind of never thought of it. The last couple of years helping people with weight loss, I'll be honest, with the carnivore diet, I kind of looked at the other way because I'm like, not that I didn't think it was good or helpful, but I was like, how am I going to get patients to adhere to this? But I keep seeing more and more and more explosion of this and awareness of it. And I'm like, holy shit, this thing must be this freaking good. And enough people are doing it. So that's what kind of motivated me more to give it a shot. And so 4 weeks after my blood work, testosterone levels came back 290, obviously still low, still, working its way up. But I felt no energy crash. I felt great at 290 total testosterone. So I was talking to Dr. Cybus about that. And it's interesting. I'm curious what you think, but because I've seen you talk about how it increases testosterone levels. Like, how is it that I could be not feeling what most people would feel at that low of a testosterone level? They wouldn't feel good, and I felt great.
Yeah, I mean, I think this is a little bit of a misconception around testosterone. I mean, obviously, testosterone is critical for health, right? Men and women both need it, right? But I think what we do is we sort of myopically focus on the hormone level in the blood, whether it's total or free testosterone. Obviously, there's, the free testosterone is probably the more relevant portion of that. But we also remember there's two sides of that equation. And so there's a receptor that has to be bound to. And that receptor sensitivity, that receptor density greatly influences. And so we talk about insulin resistance, right? So we have, this concept of, if we have really good insulin sensitivity, then we don't need as much insulin. Right. But as we become more and more insulin sensitive, we just don't have to produce as much insulin. That's considered good because sometimes some of the off-label uses of insulin, so to speak, can be negative. I mean, insulin, it's kind of interesting. When you become insulin resistant, you probably become resistant to the effects of insulin as it pertains to glucose, but not necessarily fat storage, because insulin's a storage hormone, right? So what happens is people become profoundly diabetic. Their blood glucose goes up. Their insulin's not working for getting glucose into the blood or out of the blood into the cells, but it still stores fat pretty nicely. So you've got more and more and more insulin. You're getting fatter and fatter and fatter, and your diabetes is getting worse. And so Stu Phillips, who is a well-regarded muscle and protein researcher up in Canada, one of the top guys in the world, did a paper in I think it was 2018, and he looked at a bunch of college athletes, and what they did was they did a bunch of muscle biopsies, and they tracked hormone levels. They tracked testosterone, total testosterone, free testosterone, DHEA, sexual hormone binding globulin, growth hormone, all this stuff. And these are guys not on supplementation. These are just normal, natural guys. And what they found was their serum levels of hormone had very little impact on muscle mass. The biggest driver of muscle mass was what they found in the muscle biopsy was the androgen receptor density. right? And so what happens, and so what are the things that increase androgen receptor sensitivity and density? One, weight training. I mean, just lifting weights will do it, right? Number two is going to be actually, believe it or not eating all the time, like some level of I'm not saying like multiple day fast, but like what happens on carnivore is you often eat twice a day. That's pretty typical. So you're not eating every 15 minutes like you might on a carb-based diet. And the other thing is carnitine. And where do we see carnitine come from? Well, it's a meat product, right? So you see a lot of carnitine in there. So the combination of those three things probably has increased your androgen receptor density or sensitivity. And naturally your body's like, well, I don't need as much testosterone, so I can get away with a little less. And so that's what I talk to people, because, if you go to the doctor, well, you wouldn't go to the doctor. If you go that, hey doc, I wake up every morning with an erection, my libido is good, my muscle mass is good, and I feel great. And then if you say, well, my testosterone is only 270, do I need to be on testosterone? And as a doctor, you should say, no, why would you need to do that? There's no clinical indication for that. But the problem is, a lot of people say, well, it's only 290. We need to get that up over 700 or 800 or 900 or 1,000, even though you have no clinical reason for it. So I think we have to realize that a good provider will say, what's going on clinically, and not get so hung up on the numbers. And again, like you're experiencing, like I had mine tested, I've had mine tested like 3 or 4 times over the last few years. The highest it's been is 500. The lowest it's been is like mid 200s. I'm still deadlifting 500 pounds for 10 reps.
I wouldn't think your
50s,
testosterone.
right?
Yeah. You looked at a higher level for sure.
Right. Yeah. So the highest I've seen was like 5, maybe 500 or something like that. I don't really care. I'm not worried about it. I'm worried about, if I'm looking at numbers, I'm like, what kind of weight's on the bar? What can I pull? And then again, do I wake up with an erection? How do I function? That to me is what's important. The numbers are all just whatever. I don't get too excited about that stuff.
Well, gosh, that's so fascinating. You talk about the androgen receptor density, because these TRT clinics, I mean, that's a massive business. So my clinician,
it's 4 billion a year. It's 4 billion a year in testosterone.
Oh my gosh. Right, sure. Yeah. My clinician, so they've been doing TRT for a while. And again, we always push it on lifestyle. And the one thing that we like lifestyle with it, and I guess it kind of parallels what you're saying, is we're not chasing numbers. We're symptomatic resolution through the combination of lifestyle and TRT. And maybe, with carnivore, we wouldn't have to put as many. I mean, this is new, right? This is 2 months. My clinicians are.
Well, I mean, I will tell you, I certainly have seen people that have been on TRT and they go carnivore and they're like, I don't need a TRT. Right. I mean, they're just like, I don't need it, and I get it. There's some guys that just like to be stronger, and it's going to do that. I mean, if I were to go on a TRT, I would be stronger, but I'm already strong. I'm already damn strong for a damn near 60-year-old. I don't need to be any stronger, quite honestly. But I mean, it's just like, there's some of that, but I mean, like I said, I think the less drugs you're on, the better in general. Right. I mean, this is a general heuristic. 100%. I mean, not only it's just a hassle. I mean, it's just like extra expense, hassle. Why do I need to be on a drug if I don't need to be on one?
Yeah, no, I agree 100%. So looking at weight loss now. So if we kind of take a little bit more from just general population, we got obesity, we got even near obese, overweight individuals. I'm looking at, okay, the goal is to help these people, because I do large group coaching, one-on-one, I do small group, and then my clinicians prescribe. So I'm trying to honestly figure out now how to approach this carnivore. So like I said, it's been 2 months with my personal journey. Everyone's like, Dr. Jones, like, are you saying we all have to do it now? And, is this the proper human diet, as Dr. Ken Berry talks about? So I'm literally in the middle of trying to make sense of all this right now. And where I'm currently aligned with is that I feel like we don't know long term. Obviously, if you feel great on it, keep doing it, right? That's kind of been your motto from your first interview with Joe Rogan. I heard you say, like, I feel great, I'm just going to keep doing this, right? And he was like, you're not doing labs. You're like, but I feel great. The labs don't even tell me much. I thought that was pretty cool. When you said that, it made me laugh.
Well, I mean, I've looked at thousands and thousands of labs over the years as a physician. And I know that, like, what lab is going to give me the information that's going to really change what's going on. Like I said, if I am sick, then labs can be more, I think in many ways more helpful. I know there's people saying, well, you could detect something before it got worse or something like that. But the reality is, and this is the other thing that's really important, because then we're finding this out, the more and more people that do this, the lab sort of reference ranges that we have for the general population are based upon kind of a sick populace of people eating 60% carbohydrates and a grain-based diet And those labs, when you extrapolate those to a healthy carnivore population, don't always line up. There's areas where they just don't match. And the uninformed clinician will see that and say, oh my God, this is bad for you. You can't be doing this. Oh my God, your creatinine went up a little bit. Your kidneys are shutting down, or oh my gosh, your cholesterol went up.
You have given me a heart attack.
Yeah, and the reality is that's probably not the case. It's just that people are unaccustomed to this because the average American is pre-diabetic. I mean, the average American has an A1C of like 5.8. I mean, that is what the average American is now overweight, and many of them are obese. And so we're looking at a very different population. It's just like if you were to study, if your specialty was I am a specialist in cats. And then you try to say, well, what about this dog? And you'd say, well, there's things that don't necessarily match up between a dog and a cat. And I think when you adopt a carnivore or even a low carb ketogenic metabolism, that's a different physiology. And I think the labs can reflect that. I'll give an example. Back in the early 1920s, they did a lot of studies, metabolism studies on Eskimos, because these were these crazy people that are just out in the cold eating basically just meat. And I thought they were really weird and what was going on. There were two populations they were looking at, and they were studying vitamin D. And they had low vitamin D because they live up damn near the North Pole. There's no sunlight. It's dark all the time. So the vitamin Ds are not surprisingly low. And with vitamin D deficiency, you get this condition called rickets. This is like kids will get this where their bones won't form correctly. And they saw that two populations were there. And one group had rickets and one did not. And they looked at the vitamin D levels and said, well, the ones with the rickets must have really bad vitamin D levels. Well, it turned out they both had really low vitamin D levels, but only one group was getting rickets, even with the same vitamin D level. And they said, well, what's the difference between these two populations? And the major difference was group A was eating the standard Inuit diet of, caribou meat and walruses and whatever, blubber and that. And the other group was eating some of that, but they were also eating flour and sugar and canned foods and things like that. So even with the same blood levels, you can have different outcomes, which is something that I think we have to be cognizant of.
We're going to have to get a separate reference intervals for just carnivores, right? You guys are going to come up with that?
Well, I mean, that's what we'd like to see because we start to see trends. I mean, I can tell you, I see a lot of people with carnivore with relatively lowish folate levels. I don't see any clinical issues with that. I see people obviously, particularly as they get lean, with higher cholesterol levels. I see some people with lower T3 levels, again, with absence, no signs of hypothyroidism. So again, we get into this sensitivity. Are they thyroid sensitive, which we also know can occur. We see, LP-PLA2, which is a marker of, can be a marker of vascular inflammation, but it's also tied to how much LDL you have. And so it's just really the activity you want to test and not that. I mean, there's a number of things that we see that are just not necessarily, they don't line up with the RDA or not the RDA, the standard reference range, but they don't seem to have a clinical negativity attached to it, at least that we can assess.
You haven't seen anybody with scurvy yet on the carnivore diet?
I have not. I have not seen a single scurvy case. I mean, I've seen a few people say, yeah, my gums were bleeding a little bit. Again, there's a lot of reasons for that. I mean, it's not like I said, but I've never seen like a florid actual case of scurvy. And the interesting thing is scurvy, I mean, it kills people. I mean, it literally kills people within. Yeah. And I mean, and most people start evidencing sign of scurvy within a month or two, right? So I cannot tell you how many people have done carnivore for more than 2 months. I've been doing it for now almost 9 years.
Gosh, 9 years. Wow.
Yeah, I don't have scurvy. I mean, it's just not a valid concern. And I mean, the reality is, I mean, even back in the late 1800s, we knew that people that actually had scurvy would actually reverse it with meat, and they would prevent it with meat. And it was just because these sailors that would sail in, the British quote unquote limeys that would get scurvy because they were out at sea and they didn't have fresh meat. They just had dried meat. So salt meat and stuff like that. That, by itself is not able to prevent scurvy. But if you just have access to a steak from the grocery store, you're not going to get scurvy.
Yeah. Yeah, no, I think overall this different reaction from the body when it's closer to or at the proper human diet, we just don't even understand what that looks like to be able to label it. So yeah, that makes a ton of sense. When we're talking again in the weight loss category, individuals trying to make dietary changes. So we have the autoimmune categories that are also overweight. I think with them, the conversation is obviously, hey, we got this thing called the carnivore diet, and this is what we can tell right now is probably the best intervention for you to do. So, motivate them to do that. And I think it's easier for them, right? One big thing I learned at this carnivore retreat that I went to was unequivocally the individuals that were successful adhering to it. Cause that's my big thing is I'm just trying to figure out how I can tell people, hey, like this is sustainable, right? Is that they were all prior sufferers from autoimmune disease. So if we look at the non-autoimmune, but still metabolically dysfunctional overweight category, are we motivating them to do carnivore? Or are we saying, give it a shot, see what happens? Cause there's that fear of like, man, this sounds so restrictive, I can't do it. How do we muddle around that sort of like concern that individuals have? Because that's why they blow it off. I'm not going to do that. That just seems it seems unreal, and they kind of look the other way.
Yeah, I mean, I think if you just say like, I got somebody who's needs to lose 50 pounds, but otherwise is relatively healthy. Maybe they got a little bit of metabolic disease. They don't need to do carnivore. I mean, that's clear. I mean, yes, they probably need to get rid of ultra processed garbage and too much sugar and some of this other stuff in there. And I think that's a fine initial approach. And then some people, you kind of walk them down. I mean, I didn't start, my journey onto carnivore was like an 8-year journey before I got there. And it was start out with the standard low fat, high fiber, lean protein version. Found out that wasn't sustainable for me over the long term. Then low paleo, then low carb, then keto, and then finally carnivore over about an 8-year period. And I think a lot of people, where it can be beneficial, as you mentioned, is very simple. It's not complicated. You're not tracking things. You're not thinking about this. It's a really easy diet to implement. It doesn't require any sort of, challenging things to think about. I think what a lot of people find is like, why do you, because a lot of people will tell me that, well, the only reason carnivore diet works is because you cut out junk. And
I hear that a lot, by the way, too.
Yeah, but the problem with that, and I don't disagree that that's a good idea, but the problem is that I have many, many, many thousands of people that already cut out junk. I mean, they're already eating a clean diet. They stopped eating processed food. They stopped eating sugar. They stopped eating oils. And yet they still had symptoms of disease. And it wasn't until they went full carnivore that those things went into remission. So, and again, there are some people that do great by cutting out garbage, and that's fine. And I think that's a good place to start with. And you say, hey, let's just assess you and say, hey, look, let's cut out like my friend Vinny Tortorich says, no sugar, no grain. Let's start with that. We cut out the sugar, cut out the grains, see how you do. Okay, I feel better. I'm great. Everything's good. Good. Keep doing what you're doing. For those that are like, yeah, I'm still struggling, or, I think some estimates say that about 14% of the population has food addiction, has a food addiction, which kind of mirrors what the rate of alcoholism is in this country. Maybe in some overlap in the same people in many ways.
I think so.
Those people often have to be, completely abstinent of some of these things. They can't moderate very well. It's like trying to tell an alcoholic, hey, just cut back, maybe have a margarita or two on the weekend, you're good. Yeah. It doesn't work very well. It's usually backfire. So the problem with that for those people is that, it's so easy to backslide. And for me, if I have anything carbohydrate based, I'm hungry. It just drives me to want to eat more. I mean, I'm just like, I'm a big guy. I got a big appetite. I walked around at 290 pounds for 20 years. I mean, I'm just wired to eat a lot. I could easily put down 8,000, 9,000 calories in a day. I fortunately don't do that anymore. Very, very rarely do I do that. But occasionally I can still put down 4 or 5 pounds, 6 pounds of meat in a day, and that's a lot of food. But so I think that, and the other thing that's here's the other important concept. I know you went to Kiltz's retreat and a bunch of carnivores are all gung-ho, rah-rah, it's the greatest thing.
Super gung-ho.
Yeah. And I mean, because there's people that they've changed their life. It's like life-changing, right? It's just like, and those people are like, I do not want to go back to this living hell anymore. Right. I know what that entails. I am so much happier here that I'm okay with restricting my diet. But the reality is that most people that do carnivore for, say, some of those other reasons, like maybe they just want to lose some weight or they're diabetic.
Just want to get healthy.
They want to get healthier. What they'll do is they'll do it a couple months, 3 months, 6 months. They'll feel great. They'll be awesome. They'll lose their weight. They'll feel wonderful. And then stuff will start creeping in a little bit, and then maybe now they're 90% carnivore and still doing pretty good. And I think that's still reasonable. And then they may just go like just vacillate. They know I'm going to clean it up. I'm going to go carnivore for another month, and they're going to kind of get into this thing. I'm not the religious guy that says everybody on the planet needs to be carnivore, and if you're not fully carnivore, you're a bad person or anything. I don't care. I mean, it's just like whatever's working for them. So I think I try to if I'm going to sell this as a diet, I tell people, hey, this is a therapeutic intervention, right? You're sick. Let's fix you. This might take 3 months, 6 months, a year, whatever it might be. Let's really focus, get it done, and then reassess and see what you want to do. And, you know, I mean, you're not going to be able to go back to eating Doritos and Coca-Colas and Twinkies, but you might be able to have a diet where you're mostly meat and maybe you have whatever, a little bit of rice, a little potato, a little bit of vegetables and fruit from time to time. Maybe every once in a while you have like a birthday cake, you know, on your birthday, like it should be, not every day a meal 3 times a day, like most of us eat it. And so I think that is a pretty good approach. So if you just say, look, this is a time-limited therapy. We'll see how you do with this. It's very simple to follow. You know, and some people have to be transitioned in. I mean, there's people that, and for those people that are really sick, they're on a lot of meds. I mean, this is where like our company, like Revero, is really essential because you have a physician that can oversee, as you mentioned. You can't just DC meds willy-nilly. I mean, there's some meds, like you start cutting back some of these like psychiatric meds and people start seizing, you know, I mean, or, you know, you cut out their diabetic meds or you don't cut them out and they start going hypoglycemic and same thing. So you got to, in those cases, it makes sense to have some sort of, you know, intelligent support rather than some guy on the internet telling you to stop taking your meds and, you know, that type of stuff, which sometimes happens.
No, and that's why I'm excited, by the way, to be able to refer over to you guys. Cause, you know, for us, we have those conversations. I have those conversations when I'm coaching. Yep. And, you know, I do the difficult stuff that my coaches beneath me struggle with. And the conversation about, well, I'm on these meds comes up all the time. And I got to stay in my lane and say, look, like, you know, we're making these changes to your physiology with the carnivore. My background is more deep fasting and now adding a lot of carnivore, but that's how I beat my obesity was a lot of prolonged fasting. And so I tell these patients all the time, like, you're going to have that conversation with your doc that's prescribing you this stuff. And, you know, sometimes they're going to tell you, I don't think this is a good idea, or you don't want to do it. And sometimes I'm even like, just tell them you're going to do it. They're legally going to have to work with you. Just make sure they're working with you. Don't, like you said, don't drop willy nilly, but expect some change with the lifestyle interventions that we're doing right now.
Yeah, I mean, and that's the thing is, you know, like I said, we know, like I did some survey about 3 or 4 years ago on about 12,000 people on this diet, and I asked them about specifically a whole bunch of questions. But one of the questions I asked them was about support. Is your physician supporting you on your decision? Family, friends, coworkers, and the folks that did have support, they had a supportive physician, they had a supportive environment, were about 30% more likely to remit their disease or to have these improvements. And so if you have a physician that's fighting you or doesn't want to help, or that sort of predicts lack of success. And so with our physicians, we're certainly going to support that. And so, I mean, that's the thing. I mean, a lot of physicians, depending on their practice, and I hopefully we'll get folks that are willing to refer to us, because it's like, you know, I want to do this stuff, but I just don't have the resource or the time. I mean, I'm
Right.
on that 15-minute clock like most physicians are. It's like patient every 15 minutes, and it's just not tenable or not tenable. But it's not feasible to do what needs to be done. And so this is like, hey, just send them over to Revero, have them sign up for us, and then we'll take it from there, and we can get these people hopefully supported and fixed so that they become, you know, what they should be, healthy people.
Oh my gosh, I'm thrilled to see that you're doing this, and we'll definitely network on figure out what the best way for me to send people to you. So yeah, and I guess it you know, it's really refreshing to hear you say that too as well. I maybe it was just me feel like I had this notion that you were definitely more on the stricter side of the carnivore, and then going to that retreat, I was like, whoa, you know, and not whoa as a bad thing, just okay, practicality, because when I'm talking to these individuals, it's a struggle. So it's definitely refreshing to hear. And, you know, I'll share with you a little bit, like where I've been at is kind of like you said, you know, the individuals that are on board have the reason, autoimmunity, we push them into it. And then for the ones that just want to get healthy, I've been doing a lot of this carnivore flexible, which does embody, from what I can see. So I do fruit, dairy, as that additional, so they have something else. And I've got a lot of positive response of people saying, hey, this looks more sustainable to me because the fruit, the dairy, and once I get them more insulin sensitive, then we can start adding a couple more carb sources like some potatoes and some rice. So on lifting days specifically, I'm really, really big on lifting and having some carbs when you lift. Then by the way, on that, I saw you talk about how the lack of carbs hasn't affected or impacted your ability to train at all, which is pretty fascinating.
Yeah, I mean, and again, more and more of the sports literature is supporting that. I mean, I think you're going to do well with whatever you're chronically adapted to. I'm chronically adapted to not needing carbohydrates. I mean, my blood glucose is plenty high when I'm lifting. I mean, I've seen my blood glucose up around 300 after a real intense set, and that's without taking any carbs, because my liver just dumps glycogen like crazy. And we see, now we got athletes wearing CGMs, like triathletes, like world-class triathletes, and their blood glucose will be 400 while they're competing. So we know that, our body has that capacity to do it. And I mean, gluconeogenesis,
right,
maybe more efficient. It depends. I eat a lot of protein. So, I mean, that certainly probably has an impact on that. But the thing for me, because like I said, I'm nearly 60, and what I find to be most beneficial for me, as opposed to maybe a 20-year-old, is that I just don't have the aches and pains that I had in my 40s and stuff that was really slowing me down. So in my 50s, I just feel better. And so when I feel better, guess what? If my knee doesn't hurt, guess what? I'm more willing to do a leg workout. But when my knee was hurting in my 40s, I like, I'm going to skip that leg workout today and maybe just do something, maybe do a little upper body again or something like that. And so that over time leads to improved performance. So, I mean, you may trade off the short-term advantage that you might get in power output with a little bit of carbohydrate on board. However, it might lead to a long-term decrement in performance due to just discomfort. And it's interesting. You look at, like, as an orthopedic surgeon, this is something that I didn't find this out until later in life. But I mean, when I used to stick scopes in people's knees, I'd scope shoulders, scope knees all the time, thousands of them. I had my camera in thousands of people's knees. And when I get in there on a young kid, like say a 15-year-old kid comes in for some injury, you're in there and that knee looks beautiful. I mean, it's white and just perfectly pristine. There's no nothing. It just looks like it's just beautiful. And then you get in there on a 50-year-old. And it looks like you're on the inside of an ashtray. I mean, it's all discolored and brownish and yellowish and crumbly. And it's like, why is it yellow? And I just never really got into why that is. But it's really what's going on is you have this so-called Maillard reaction, it's sort of the browning that occurs. It's like when you cook a steak, you get that nice sear on it where it's nice and brown. It looks real pretty. The same thing's happening in the joint, and that is the interaction of sugar and protein. This is the Maillard reaction. So what you got... And so the main biochemical difference between a young, healthy joint and an older joint is really the degree of glycation, right? So how much glycation are you exposed to, and what's driving glycation? High blood glucose for one, high fructose levels for two, and then oxidized fats. Lipid peroxidases, or lipid peroxides, are what's causing that oxidation. And so how do you mitigate that? Now, you can't prevent it entirely because you still have blood glucose, you still have oxidation occurring, just the act of living and breathing causes that. But you can slow it down a lot. So instead of developing arthritis in your 50s, you might not get it now until you're in your 80s if you do the right things dietarily. And I think a carnivore diet is on the right path for that. And if you think about, when we talk about glycation, right? So one of the most powerful known anti-glycating agents, compounds that we know of, there's a great deal of brain research on this showing what prevents brain glycation. It's actually carnosine. So carnosine, again, sounds like carnitin, that's found in meat as well, exclusively. You can't find carnosine in anything else other than meat. So again, eating meat may not only prevent the high glucose levels, but it also prevents, or also may mitigate any glycation that's occurring through carnosine. So it's interesting. So healthy joints make you, that's why I can run fast, whereas most guys my age, particularly at my weight, there's very few guys that are my age and weight that can do what I'm doing right now. And probably I would say, I don't even know if there's any. I mean, there might not be any.
Not running that fast. I was pretty impressed.
So I mean, it's just kind of pushing that envelope and seeing what's out there. And I suspect that, because like Inuit were incredibly strong people.
Right.
I mean, they weren't very big. I mean, they weren't big people. They were like, $150, $130 or something like that. They were not that super tall, but man, they were super strong. I mean, you see those guys like wrestling seals that weigh like 400 pounds and yanking them out of the water. And I mean, it's so anyway.
Yeah, I think there's a lot to unravel there for sure. So, man, Doc, this was amazing. And I appreciate you taking the time to have this conversation and answer some questions about carnivore, because my audience is going to greatly appreciate it. They've been asking me these questions, and I've ruffled some feathers because I actually had some upset people because they're telling my coaches like all Dr. Jones is talking about is carnivore now because I do my group trainings. And I'm like, look, I'm excited, but I'm bringing it to you. Would you want me to just not bring it in and just keep not be up to date with the research and what we're understanding? Like I'm bringing this into you because I think we need to be doing this. This is important, and we're seeing some pretty big changes. So yeah, it's refreshing to hear you say, what you said about it, and I'm excited for what we're going to continue to see. Do you think? Last question I'll ask you is, how long, I guess, / do you think we'll see some more data in the long-term side of things when we start asking those questions, right? About is the carnivore diet the proper human diet for a larger population? Do you think we're going to head that direction? How many years would it take? Like not necessarily a pure strict carnivore, but that animal-based kind of keto that we were talking about earlier.
Well, I mean, again, obviously, if you want to say definitively that a long-term diet, you got to study it for a long term.
Right.
And quite honestly, right now, there's really no diets that have had rigorous long-term, evaluation. There's no like 20, 30 year randomized control trial on a diet where all the variables are strictly controlled. Now, what we are going to see in the literature, because I'm helping to do some of these things,
I figured,
we're going to see more and more publications. I mean, we've seen studies already on inflammatory bowel disease. We've seen it on mental health disorders. We've seen it on things like anorexia, a couple of the autoimmune conditions. Multiple sclerosis, we're going to be publishing in the very near future. That'll be followed by psoriasis. Amazing. We're probably going to see some interventional trials on diabetes, and then also probably inflammatory bowel disease, which I think will be the first, interventional trial perhaps that's going on. So we're going to see more and more of that stuff. Obviously, the pushback is coming. I mean, you see just in the UK, there was a big article talking about, carnivore leads you to more likely to have kidney stones. And then they say, why is that? Well, because we saw some urine markers that are associated with kidney stones, yet none of the patients actually had kidney stones. Yeah. But we're going to make these correlations based on biomarkers just because we don't like this. And it's taking away from our advertiser dollars who want you to eat, squishmallows and whatever. I mean, whatever, it's stupid foods they sell. So, yeah, I mean, I think, honestly, irrespective if we have a lot of studies, there's going to be more people doing this because you can't keep the lid on this any longer. I mean, you can't prevent people from sharing what they're sharing and seeing what they're seeing. I guess you could. I mean, if you shut down the internet and censor everybody, but hopefully we're beyond that. We've gone beyond that date. Yeah. So I think as long as there's ability to communicate, and again, like I'm not the first guy. I wrote the book, The Carnivore Diet. I called it that. I'm the first guy that kind of popularized that name. But I mean, there's been doctors talking about this for hundreds of years. I mean, this is not new. It's just now that we live in this age of massive, rapid, worldwide communication that we can disseminate this information. And like I said, if carnivore diet is a fad and it doesn't work, then it deserves to go the way of the dinosaur. That's not what I'm seeing right now. It's growing and growing and growing and growing. And I think, I think the other thing that's really interesting is, there's a lot of gaslighting going on in the world around different things, climate change, political stuff. This guy's a bad guy. That guy's a bad guy. It's really hard to gaslight people out of their own health. I mean, you can try, and people do that, and they'll tell them, what's going to happen in 20 years? But it's like, wait a minute, I was sick yesterday. I'm not sick today. That means something to people, and they're going to get that. And I think most people are going to want to feel better. And so I think this is going to continue to grow as long as people are getting healthier. And I see no reason why it wouldn't, because in my experience, after doing this for nearly 10 years now, I just see people getting healthy every day. And you just can't. I'm a very conservative guy when it comes to thought, some of the thoughts. I don't go out there and follow the latest trend because I think most of it's just smoke and mirrors and BS. But the only reason I've been so compelled to do this is because it's undeniable. I mean, you saw the people at Kiltz's Plates. These people are real people that have real stories, and they can probably show you pictures. This is me 3 years ago. Look at me now. I was on 25 meds, and I was walking with a cane or a walker, and now I can skip and dance and do backflips. So it's I just don't think I think it's gonna continue to grow.
I love it. Thank you so much for taking the time, Doc. I really appreciate it.
Well, appreciate you having me. Thanks.
Absolutely.
And like I said, just Revero.com. If you got patients, send them our way, man. We'd love to take care of them.
Yeah. No, I definitely will. And if it's that simple to get them over to you guys, then that'll be easy enough there. So thank you.
All right. Appreciate it. Thanks.